Happy Friday!
It is Friday.
Happy Friday, Jess.
Happy Friday. What is this?
So there's this place that just opened up down the street, and it's called
Oh my god.
World Famous Daiquiris and Margaritas.
To go.
And it's literally down the street, and they do package it so that you can take it home. So I went and got one yesterday, and the girl said that like we could defrost it or whatever, and they defrosted pretty well.
Yeah.
This one is blue Hawaiian and coconut. I'm feeling very tropical these days, so.
I'm feeling really chill because today is going to be a really cool topic, right?
What are we talking about today?
Something really cool, like CoolSculpting.
CoolSculpting.
Yeah. Hence the blue drink. Ashley did that. She coordinated that really well.
Okay, well,
Okay,
in addition to it being a CoolSculpting day, it's also Jessica's national holiday.
What?
It is
Tell about me.
National Tell a Joke Day.
Oh my gosh, you
And
guys.
you know, Jess, she is the biggest lover of Laffy Taffy jokes,
Oh my gosh. Popsicle
corny
stick
dad
jokes.
jokes.
Oh yeah.
Yeah.
You
So,
name it.
can I tell you one real quick?
Yeah.
I got some good ones.
I'm
Okay?
glad you gave me some of these because
So listen.
I haven't read them yet.
Sylvester Stallone, Bruce Willis, and Arnold Schwarzenegger. That's a very manly bunch.
Mm-hmm.
They were making a movie about classical composers. So Sylvester Stallone said, "I'll be Mozart," and Bruce Willis said, "So I'll be Beethoven." So then Schwarzenegger announced, "In that case, I'll be Bach."
I'll give you that one. That was good. That was good.
Okay, give me one,
Okay.
Jess.
All right. So let me just get logged on here so I can see you guys in comments. But while we're getting our jokes going, I do want to remind you guys to make sure you do like, make a little comment.
And I just decided that we're going to let everyone give us their best jokes, their
Yes.
favorite, funniest jokes, and then I'm going to have Dr. Sukar judge which one's the funniest, and that person will be the winner of, drum roll please.
Dun, 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 dun.
Yeah, that's what I was looking for.
Go.
A free CoolSculpting cycle.
Yeah. But one little tidbit I'd like to add on there is you do have to click that little share button right there. Okay, right there. Just all you have to do is just tap it.
Mm-hmm.
Tap it, girl. Little love tap. Okay, y'all ready for my joke? Okay, so let me just make sure we are on. I can see you guys' comments. So it'll take a second. Okay, you ready?
Yes.
Okay. All right. Why did the Scarecrow win the Nobel Prize?
Why?
Because he was outstanding in his field.
That was a good one. Okay, I have one more.
These are good.
And I really want to, okay, so I've been really into Frasier lately, which is weird because I know y'all all watched it.
You're going through a
Years
phase.
ago.
I'm going through
Frasier
and Cheers.
Yeah, Cheers too. So
Yep.
this one just kind of hit close to home because you know Frasier is a psychologist.
Yep.
So how many psychologists does it take to change a light bulb?
I don't know.
Well, it depends if the light bulb wants to change.
That was
Okay.
great, buddy.
So
That was
leave
great,
your
buddy.
jokes, guys, and we'll pick
Yes,
the funniest
yes, yes.
joke Monday or Tuesday to win a free CoolSculpting cycle.
I'm so
So let's
excited.
jump into it. What is CoolSculpting? I mean, we've done a live CoolSculpting demo, but we haven't really talked about it on the PS show.
I know. Okay, so in a nutshell, because we're going to dive into like FAQs, CoolSculpting is a non-surgical way to kill and get rid of fat cells. So that right there is amazing.
Yeah.
That there's even a non-surgical option. I just want you guys to know I'm not getting on my phone, but my computer's not working, so I'm going to get on our Facebook through here, okay? So I'm paying
CoolSculpting is the cool, non-invasive way to lose inches. We definitely like to have, for every invasive procedure, there's a, equal but opposite non-invasive procedure that you can do, because we understand there's plenty of people that are not okay with going under, and that's okay. I mean, you know that we're 100% safe and everything.
Yeah, surgery's not for everyone,
but it's not for everyone, definitely.
Yeah, so, I mean, surgery's a great thing, non-surgical options are a great thing, but some patients, maybe you're a good candidate for surgery, but you don't have time for downtime. Or vice versa, maybe you're not a good candidate for surgery, like health-wise, but you're a great candidate. This would be a great option for you.
And it's also really good for that just little bit, that little pooch, that little bit of fat that you can't get with diet and exercise. You can't, eliminate.
And that kind of brings me to a good point. We have a lot of patients that come in and get CoolSculpting that are very fit. They're bodybuilders, and non-bodybuilders as well, but bodybuilders who are working out, they're exercising, on diet restrictions and plans and prepping, and there's just these little areas that are stubborn and won't go away. And so CoolSculpting is great for that. So it doesn't mean that you have to be as lean as possible or, at the other end of the spectrum. But if there's areas that bother you and you don't want surgery and you've got pinchable fat, we can treat it.
If we can pinch it, we can freeze it.
That's right, girl.
So let's talk about kind of what CoolSculpting is. Like, how does this happen?
Okay.
How is it that you can lose inches without going under the knife?
It's kind of like magic, like some kind of crazy sorcery.
Okay,
so
tell me the sorcery.
Okay, so the sorcery of CoolSculpting. CoolSculpting, the way it really works is, well, first we're going to have you in, we're going to fit the area, make sure you're a good candidate, and we're going to, it's almost like playing Tetris with the applicators and putting them on the area to make sure you get maximum coverage. But once we initiate treatment, what happens is your tissue is pulled into the applicator, and we're freezing fat, we're getting it to freezing temperatures where we crystallize it. So some patients are like, ooh, like, what is that going to do to my skin? Am I going to get frostbite? Like, is something weird going to happen? No, the technology behind CoolSculpting is so amazing because it's almost like it skips the skin and goes straight to the fat. But we're going to get it down to freezing temperatures.
Okay.
And once we get it down to freezing temperatures and the session is completed, we do a nice little massage. Not so nice. But it's important. It increases efficacy by I can't remember.
1 billion percent.
Yeah,
it really
insane.
does. And it's kind of just like, okay, so everyone has been through this where your mom called you like 3 hours ago to take the meat out of the freezer because she's going to be cooking, and now it's like 5 minutes until she's about to get home, and it's like, I hope you took out, no. Okay, so you know how the meat, when it comes out of the freezer, it's really hard, but you can like kind of thaw it out by massaging it.
Yeah,
that's exactly the same concept.
Yeah, so once the applicator is removed, that tissue that was pulled in it's gonna be like a block of butter. I'm not gonna lie. That's really what it looks like, right? Butter. Yeah, butter. So what we're trying to do is we're trying to break all that up and soften it back down.
And so that you don't have like a weird block of butter.
Of butter. Who wants butter? Not there, I guess. Anyway, so once the session is completed, we do massage it, and then what happens over a period of time after that is those crystallized fat cells begin to break down in your body, metabolizes it, which really just essentially means you're going to urinate them out. So it's not that you're going to see them come out,
right?
But it's going to go through your lymph system.
My biggest question about this was, does that mean more potty breaks? Does that mean more long potty breaks? Like what does that mean? But no, it's not, you're not going to even tell. Your body's naturally going to get rid of it with its already, existing waste or whatever.
Yes, exactly.
So one thing it's kind of weird, like how did these scientists figure out that you can freeze and kill?
She tells the story so great.
Because it's so cute.
Yeah,
okay,
it's awesome.
We should have had popsicles.
I know.
So they noticed that these little kids that were eating popsicles would start to lose the fat in their cheeks. So after a lot of popsicles, which I probably could have participated as a child in this study because, I should have because I have big cheeks. But I'm saying I love the dimples. But it's like hair. When you have blonde hair, you want
this color
dark hair. It's just like dimples.
Yeah.
But anyway. So the little kids were eating these popsicles. They were eating a lot of popsicles. There was actually little kids in Mexico that they were doing this study on. So it could have been, I wasn't in Mexico, but anyway. So they noticed that, if they would only use it on, or they would only have their popsicles on one side, a lot of kids, they favor one side and they'll put all their food on one side. They would put their popsicles on one side, and that was the side that was losing fat. So it appeared to be smaller. That's exactly the type of technology that they took for CoolSculpting. Obviously, it was years afterwards to develop this technology, and who would have thought that you can just free? All the Eskimos just like super. I know, right? And all the Eskimos, they must be super like thin, but it doesn't work exactly that way. We're going to target all of these the fat cells and you're going to see a 20%, at least a 20% reduction in any given area.
Yeah, it's awesome. Absolutely awesome. So a lot of patients, so that's kind of really the backing on how does it work. Another question a lot of patients have is, does it hurt? I mean, if you're freezing parts of my body, isn't that going to hurt? No, absolutely not. You know, I feel like
Have you gotten a dentist?
I haven't, but I know a few people that have.
So I have. Spoiler alert, I have. And I can tell you that it does not hurt. It's super comfortable. We put you in a comfortable chair. We put Netflix on, put whatever on. Of course, I couldn't get away with just watching Netflix during work, so I had my laptop and I was working. I even did a conference call while I was here in the room. But so what it's going to do is it's going to suck up the fat into this little vacuum thingy, and it sucks it up, and then it gets super cold. And once it gets to the point where you're almost like, oh, this is a little too cold, that's when it goes numb. So all of that fat is going to go numb. It's like whenever your tooth goes numb, it just feels like there's something like there, but you don't really know what's there. So it's just going to go numb. I'm not going to lie, the hardest part of this process is probably the thawing out. But it's for like 5 minutes max.
Yeah. It's really like 2 minutes. So.
And you just got to grin and bear it. And you know, the beautiful Ruby will be massaging you, so it'll be fine.
You can look at her beautiful face. Actually, I'll show you guys. Let me see if I have an applicator in here that I can show y'all.
So we have our wall. We're in our CoolSculpting room right now.
Yeah.
As you can see from back here, there's Rube's CoolSculpting University certificate, which she's been to 2 now. Dr. Sukar has sent her out to California twice to get certified and then certified on the newest CoolSculpting
techniques.
Stuff.
Yeah. Because, I mean, obviously the results are going to be in the technology, but the results are also in the person doing the treatment and performing it. Placement is key. Treatment protocols are key. So,
put it on you.
Whoa,
so here's kind of what.
Yeah. So this is actually one of our large applicators. I just grabbed this so you guys could see it from far away. Okay. So in here, what's going to happen is, so let's say her tummy would be marked out. We would find perfect placement, make sure this would be appropriate for her. Once it's applied, we're going to create and make sure it's nice and flush. Okay. And then we're going to turn on the suction first before we begin the treatment to make sure that it's going to actually hold and create suction. It's going to pull her tissue in here, so there's these cooling plates inside, okay? And that's what's actually going to be going through to get to the fatty tissue.
So this will be raised, it's going to be sucked in.
Pulled in, okay?
And then that's how I'm going to sit. I'm just going to sit
we'll get
back and have that on.
I got you back, girl. So, we get you in position nice and comfy before we get the actual treatment started, but we do want to get the suction in place so that way that we know it's going to create a seal.
So what's super cool, the old ones used to be flat. These now, they curve with your body. See, I know y'all can't feel it, but it curved to my exact, body. So, the other one, the old technology, we had all of that, but then once we got the new technology, Dr. Shukar's like, okay, well, let's go ahead. We have all the paddles, and we actually have 2 CoolSculpting machines.
Yeah, so we can dual sculpt, which is awesome.
So you can have both your arms going at the same time. You can have both flanks. Jana has done
medial thighs.
Up here, the inner, is that one medial thighs?
Yep. Learning something new.
Every day, girl.
Every day.
So, let's talk about the different places since we have this.
Yes, okay. So, we pretty much can cool sculpt.
If you can pinch it.
Yeah. Pretty much any part of the body. So, most common areas are going to be tummy, the flanks, which is the love handle area back here. We don't want to mess with the booty. Lateral thighs, which is the outer thighs in through here, is also very common. A lot of patients, although we want a bigger butt, some patients don't necessarily want this much wider, or this may be completely out of balance. So so tummy, flanks, outer thighs. Inner thighs, as Ashley mentioned, that's what we call the medial thighs. The banana roll under the buttocks is a really popular one because a lot of times this is not a place where we actually want to do surgery on for liposuction. So Dr. Sukar typically refers patients to doing this. And the banana roll is that, so with our buttocks we have a crease, and it's kind of like a shelf right here, okay? And below that shelf there's going to be this little roll, this little pooch right there. that typically stands out. So we have applicators that are sized to actually strategically get that, and CoolSculpting is fantastic for that, especially because that's not an area we typically want to do surgery on. Other popular areas are the arms, also the knees, like right above that little knee puff, and the axilla fat pad right through here. Oh man, that's a good one. That's a really good one to get. And some patients
that's
little
real annoying, right? Especially when you have like strapless things, or
it tends to catch and kind of like hold over. So
I know that a while ago that was like my biggest
bug bananas out here. Yeah. So obviously we wouldn't put this big old applicator on this little spot. We have a little sharpshooter that we use about this big. So we have different sized applicators and different contours.
Ooh, talk about that.
Yes, that's where I'm going next.
Okay,
so
we're going up.
So the sharpshooter applicator that we have is actually called the Cool Mini, and I was explaining we do it here and also on the little knee area. The area that it's primarily used on is called the submental area, which is our chin and jawline. A lot of us
turkey neck.
Yes, and a lot of us are becoming more aware of this because of social media. Yes, tech neck.
It's called tech neck. Where you're constantly looking down at your phone, at your computer. You know how Jana tells you, do not look down when you're after Botox or whatever. And what's our first thing when we go to check out? We're looking at our phone. We're like, exactly. Yeah. So you never really realize that you're doing that so much, and that yucky is like developing.
Exactly. So
let's do it.
You want to do a joke?
Quick joke.
Okay.
Yeah.
Okay, I'm gonna hang this up while Ash asks a joke. So,
but you're gonna love this one, Jess.
Oh, okay, I'll pay attention to that.
Okay, just listen.
Okay.
What do unicorns call their dads?
Unicorns call their dads.
Popcorn. The cornier the better with Jess.
Yes. Oh my gosh. And I'm trying to hold back the really awful, embarrassing laugh that I have because it's kind of a thing that I have. It's just awful. So, okay.
Do
so
you have questions?
Yes. So let's read some comments. So,
especially if they're jokes.
You guys make sure you put your jokes down here. So that's going to enter you to win a free cycle of CoolSculpting. So you have to comment, whether it's that you love us or a funny dad joke.
And a cycle is how so one placement of this would be a cycle. Now, if you need,
like say your flanks, your love handles, since you have two of them, that's 2 cycles because it's a bilateral area. There's right side, left side. So.
Or maybe I don't need this big one, but I need 2 of the smaller ones that will fit better around my abdomen.
Yeah.
Whatever.
So, but we're going to give one away. So you have to comment, and you've got to click that little share button there. And like I said, your comment can be a funny dad joke, or it can be that you just love us. So you can put that too. That might put you into extra drawing. I'm just kidding. Okay, so let's read comments. So Ileana said hello. So hi, Ileana. Thank you so much for watching. I love your name. Rhonda said, hello, ladies. Are you having a special on CoolSculpting? Why, yes, we are.
So we'll talk about that in
stay tuned in just a minute, okay? Jessica said, love the outfit. Aw, Jessica. Love you, girl. Okay, so, and then let's see what else we got. So we've got lots of likes.
Jessica also wanted to wear a hat today, and I
wish
I talked her out of it. I know.
I'm going to wear it next
time. But
I wanted to match, actually.
I know.
Like, be twinsies.
She wanted us to wear the same hat.
Because we got the same hat. Great minds think alike.
We already go to the same nail place. Like, people are going to start talking.
That's okay. Let them talk. Let them talk.
No, y'all know that we're all best friends here, so.
Yes, we are family. I was going to break out in a song, but you don't want to hear me sing karaoke, so. Okay, so, here, Jessica's got a joke.
Okay, tell me a joke. Okay, I'm ready.
Okay, Jessica. Alright, hold on. Okay, I love this one.
Okay,
this is really good.
Tell it to me.
This is really good. Okay, ready? Okay. What did the buffalo say to his son? Bye, son.
That was good.
Funny. No, okay, so Jessica, just so you know, I am going to be using this one later on my son. My son is 12 years old, and he gets super embarrassed because of my dad jokes and my silliness, and he follows me on TikTok.
Can y'all
and he's
imagine her being an embarrassing parent? Like, how can anyone ever be embarrassed by that girl?
Oh my gosh,
But when she starts talking about these dad jokes,
my son, he's like, really, Mom? And I'm like, you want to laugh, don't you? So he'll wait until he turns around to laugh, and he'll come back and be like, okay, it was really funny, but he won't let me know.
What was that joke?
He's like,
speaking of Angela, Ange told me a really funny one, and it was, What do you call a traveling nun?
A traveling nun? Oh, I feel like I should know this.
Wait, because it really got me. A Roman Catholic.
Angela told you that?
Yes!
That's hilarious. Oh my god.
So, Ange and Sarah, Wednesday is Wacky Wednesday, and they tell dog sheep car jokes in the OR. And that was the one when she told it to me, I was like, oh my god, was he able to compose himself? Because that's
hilarious. That's hilarious. Okay, so Kimberly said, I love you ladies so much. We love you too, Kimberly. And, okay, let's see. Cindy says, okay, here's a joke. Are you ready? Doctor, there's a patient on line 1 that says he's invisible. What does the doctor say? Well, tell him I can't see him right now. That was a good one, Cindy.
Wait, can't you see Dr. Seeker saying that?
Yes, he would totally. I'm gonna actually tag him.
I
in this
love
one.
that one.
I need to tag Dr. Seeker. Okay, so I want to tell you one more. We can tell you jokes all day. We'll probably say a few more, and then we're gonna tell you all the like super amazing news that this whole live is about, or leading up to. So my son, my 12-year-old, told me this joke, okay? And I don't know why, but it makes me laugh. Like, I even think of it at the most random times. Okay. So he said, let me just get myself together so I can say it properly because I don't want to mess it up. Okay, he said, Mom, what do you call the security guard at the Samsung store?
What?
Guardian of the Galaxy. I'm a Galaxy fan. I'm not an iPhone user, so I thought that was funny.
What minute is that? Because I gotta tell my mom she would.
Okay, 21:53.
Okay.
I'll tag Hilda here. I'm gonna tag Hilda. Okay, so Cindy, I'm totally.
Mom, you're gonna love that joke. Wait, it gets better with time.
I'm telling you, I love me some good dad jokes, and that was definitely a funny one.
Were you just
definitely
like Landon?
I know.
When did you become a comedian?
When we were driving to soccer practice or one of his games or something, and because I was like telling him jokes, we were like kind of going back and forth, and he was like, "Mom, that's not really that funny." Like kind of like saying I'm embarrassing him. I'm like, "It's just me and you in the car. Like who are you embarrassing?" Anyway, and so then he's like, "Okay, well I got a really good one," and so he told me that, and I was like, "Dude, that was good, and you are so my child." So, anywho, but
get
Cindy,
it from your mama, Landon.
yes. Cindy, we're gonna tell Dr. Cigar that joke because that's hilarious.
I love it.
Love it. Okay, let's see if we've got any more. Okay, perfect. Okay, so Cindy, Jessica, Kimberly, Rhonda, Ileana. Make sure you guys do click the share button. That way, since you did comment, you will be entered in the drawing for a free CoolSculpting cycle, but you've got to hit the share button. So you've already done your due diligence for making a comment. Okay. Oh, we've got another one. All right, Monica.
Oh, is it another joke?
Yeah. Okay. Are you all ready?
Yeah.
All right. Monica's giving it to us hard. Okay. Why did the little chicken cross the road?
The little one. I don't even know why the regular size one did. Okay, why?
Wait, hold on. Let me see if I can read this right.
Is it in Spanish?
Oh, okay, Monica. I'm going to let Ashley read it. Only because I don't want to ruin it. I feel like it's really hilarious, but I can't say it.
His mom said, Ven pa acá!
Okay, now translate.
That means his mom said, come on!
Oh, that's why he crossed the road. Oh, that is cute.
I like that one.
I do like that, Monica. Okay, Monica, make sure you click the share button since you've done your commenting and you've sent us some hearts. So click the share button so you can be entered in the drawing. Okay, so I do think we should tell a couple more jokes, but I want to tell you guys a couple more frequently asked questions.
Yeah.
So downtime.
One question. Well, downtime
Yeah.
and go ahead. Go
Okay.
through downtime because my other question is.
First of all, this is amazing.
I know.
It's super refreshing and like.
I know. I'm really excited. They also
You
have
did a good job.
They also have Jello shots.
Oh, that's if you want to get Christ. It is Friday, but it's not
we
Friday.
still working, girlfriend.
Yeah. Okay. So
Tell me about downtime.
Yes. Okay.
So there's not much to say there.
Exactly because there's zero.
How long
Actually,
does it take?
So, to cover only downtime that you're going to have is while you're physically here. But if you work from home, you can bring your computer. If you're a mom, you just need a nap. You can take a nap. That's really the only downtime is you can't be up and walking around with this applicator attached to you. You have to sit down and be still.
Just can't.
I know it's
That's
hard.
why just
That's exactly why I haven't had it done.
No, but
because
we have had several people because you're going.
Yeah, I'm running around.
We've had several people come on their lunch hour, and if they're coming, you know,
Yeah,
for
or
a couple
first
of
thing in the
days
morning,
or whatever,
or-
first thing in the morning,
or get
just
off work early.
Tell your boss, you know, there was a traffic jam or something.
Yeah, just something. Just
if your boss doesn't live really close to you, like mine does, that might not work.
So there's no downtime when it comes
Shout
to
out
cool
to
sculpting, except for while you're physically getting it done, which is the beauty of cool sculpting, because you know.
If anyone's wondering what I'm playing with, it's fat.
Yeah,
it's just, this
but
is
it's
what
not,
a pound of fat.
It's an artificial. It's
Yeah,
pho.
it's not.
pho fat. Pho fat.
Why do you say pho? It's pho.
Because I like pho noodles. It's pho. Faux fat.
Oh my God, Jessica, that was such a Jess moment.
You're welcome. You're welcome. You know, you're welcome. Okay, let the silliness continue. I like pho noodles, so I just
So
everything's
is it
pho?
fuffer?
Yes.
Well, this is a surgery.
Oh my God. We gotta dry the laughing
I know,
tears.
'cause
The
it's
laughing tears.
yeah.
Okay. Alright, cool. So, Monica, thank you so much for sharing. Okay, you ladies that commented above her, make sure you click the share button. Okay.
Put that thing back.
Okay. Whew. Okay, hold on. Let me put this back. Hold on. This hot.
We have fun here. We have fun.
We work hard, but we play hard.
So we do have all of our cycle. What are these called?
Applicators.
Up on the wall.
Yes.
Really cute.
Yes. Okay, so we talked about downtime.
So my other question was, okay, you know, surgery is one and done.
Yes.
Now it's not one and done as in once you get out of surgery you're done. No, you have to work on maintaining results and you know, downtime, recovery, all that stuff.
Yes.
But so is this one and done? Because it sounds pretty perfect.
Exactly, and the sorcery behind it is amazing. So, is it one and done? That is going to depend on the area that we are treating and the amount of fat in the area.
Can y'all see the cars that are passing by?
I know. It's gonna get.
I'm surprised that we don't have a staff member.
Oh yeah, we had a Jana behind our window a couple weeks ago. Yeah. Okay, so one and done. That is going to depend on the amount of fat in the area we're treating. Really, that's what it comes down to. Is really how much volume.
20% of any given area, right?
Yes.
So we're going to reduce it by 20%. Now,
Correct.
does that mean it's 20% and then if I do it 5 times, like, then there's nothing?
No. Because you have to think it's like
that's
20,
not how
it's about
math
like 20%
works.
of the fat.
So yeah, it would be like 20% of 100 is
20.
Oh my God, 20.
20.
20% of 100 is 20, and then 20% of that is a number, and then 20% of that is a number. So, and it's not safe to not have any.
Like you need to have a little layer of fat.
Yeah, exactly.
But what we're doing is we're kind of, it's like we're chiseling down at it. So that's why, it's non-surgical, so you do have to expect that you're probably going to need more than one treatment. So I always tell patients, expect at least 2 treatments, okay? Some patients, if there's, a higher volume of fat, we prepare them that you may need 2, 3, or 4 treatments to this area. It's going to depend on the amount of volume that we're starting with. Okay?
It depends on your goals, actually.
Yes,
what I like to say, when we're talking about cool sculpting is, do you want to look good with your clothes on, or do you want to look good naked?
Yeah, and all of the above.
Yeah, but someone that wants, let's say, 2 of the same person. I don't know how we're doing that, but
twinsies.
Yeah. Okay. Whatever. Anyway, this person wants to look good in her clothes. She's gonna need 4 treatments. This person wants to look banging naked, so she's gonna need more than 4 treatments, right? So it all depends on your goals, where you want to get to, and what your end game is.
Yes.
And we're going to be with you the entire step of the way.
Exactly.
We love cool sculpting patients because we get to see them more often.
Yes. And talking about frequency, actually, so whenever we are doing cool sculpting, a lot of patients want to know, okay, so if I need 2 treatments or 3 or however many treatments I need, when can I get that next one? And basically what it is depending on the area we're treating, so...
Like, can I just do it, do 5?
Like this week,
all
like
day?
every day?
Like, no, I'm just saying, one day. I'm going to come for, 3 hours.
No. Okay, so if it's the same area, so let's say arms, okay? So let's say we're doing your arms, we're doing down here, okay? I'm building muscle.
Look, right there, we can do that. Okay, go ahead.
Where's the gun show? Oh, it's that way. I'm just kidding. I'm just kidding. So, Anyway, okay, so let's say we're doing...
Here, it's over there.
Because there's no guns here, that's what I was saying.
Yeah, you got it.
Okay. I had to explain my joke because I wasn't quite sure if you got it. Okay. Alright, so let's say we're doing arms, okay?
Another joke.
So frequency, so we would do your arms, we would do both arms, and then what we would do is we would see you back around 6 weeks. Now, is 100% of the result visible at 6 weeks? No. As far as the results happen, from the time of treatment, it takes up to 12 weeks for the results from that first treatment to be complete. So a lot of times when we already know there's going to be a secondary or a third treatment, this is kind of secret sauce, so don't tell anybody, okay?
I don't even know what you're saying. I'm kidding now because of all the jokes. Okay.
It is National Joke Day,
Yeah.
so we're being silly.
What is secret sauce?
Okay, the secret sauce is another thing, a little,
Just say it.
ingredient is we like to have you back at 6 weeks so we can assess where your halfway result is, and most of the time we go ahead and do our second treatment at that time, and we get amazing results with the way we do the treatments, how we place the applicators. Obviously Ruby doing them because she's the master, but it's that doing it at that 6 week frequency if we already know that there's going to need to be a secondary treatment. Now there are areas of the body that we don't do that, we wait the full 12 weeks. For, like common areas that we do that, we wait that 12 weeks before we retreat, or even like 8 to 12 is the medial thigh, so the inner thigh area, because most patients don't have an excessive amount on the inner thigh area, most average patients, so we like to give it a bit more time so we don't overcorrect, right? We don't want to do that. So, but Ruby's been doing this a very long time, and she is in literally her skill level is through the roof when it comes to CoolSculpting. So, and the way she does these applicators in certain parts of the body, I'm like, wow, how'd you get that to fit there?
Yeah.
Like, how'd you do that? That's
yeah,
awesome.
I mean, there's the way that they teach you, and then, but just like, Dr. Sukar, he was taught the basics in school,
and
then what makes him the best surgeon in all of the United States and all of the earth. I was going to say earth, but I was
the earth. He is. He
is because he has taken those basics and he's created these techniques that really, really show great results, and that's exactly what Ruby is doing with what she's learned at CoolSculpting University twice, and she's bringing it back, and she's like, you know what, Ruby, that girl, she's amazing.
She
is. What she does, her results are amazing.
Yeah,
and she really works with every patient, because sometimes, everyone's goals are different. Jessica's goals for me might not be the same as my goals for me. So she really listens to the patients and, gives them what they want.
Exactly.
That was a really weird way to say it. But
no, but I love it.
Okay.
Alright, so I
Sorry,
feel like we've covered the full
let's
circle.
talk about what we're gonna do. Well,
okay,
first I got
one more joke. Okay, one more joke each, and then we're gonna. Hey, don't get off, because you don't want to miss what we're gonna announce and just.
Okay, so this didn't happen in real life, just FYI, because I love my job and I'm not gonna leave. But let's just say, I've just been in for a job interview. The interviewer asked me if I could perform under pressure. I said yes, of course I can, and I also do an excellent version of Bohemian Rhapsody too.
You actually do.
I know,
really
do.
That was so perfect for you. I love that. Oh my gosh.
I love karaoke, so I had to ask that one.
This girl can slay some Alanis Morissette. I'm just saying. We might have to have a karaoke session at some point. Yeah. I won't be participating. I'll just be filming or laughing, but this girl can rock it. Okay, let me find a good one, and then we're gonna end on an amazing note. Okay. Let's see. Okay. I might tell two, because I don't know if I think this one's that funny, but it's one of those jokes that you just gotta tell. Okay. Batman and Robin walk into a bar because they can't fly.
Oh, that's so for all you superhero followers and stuff. Dang, that was a dig.
Okay, this one's actually really funny, and my 12-year-old would laugh at this. Okay, so all right, why don't you use the bathroom in front of Pokemon?
Why?
Because they'll peek at you. That's funny.
That's funny.
That's hilarious. That's hilarious.
That's hilarious.
This is an inside joke here at the office. Okay. Alright, so what are the good?
Can I say one?
Yes.
Okay. Because it has to do with National Joke Day.
Yeah, okay,
so, we have a certain, and if you guess who it is,
Hey, that
you'll
might be some
be
extra
entered
bonus.
in
We'll
the-
give you an extra entry in the
So-
giveaway.
There's a person on our staff that will look you straight in the eye and say,
It's funny.
"That's hilarious."
And she's
100% serious. Like,
yes.
that is hilarious.
Like,
but
we're
it's
like,
like,
are
are you sure?
Was it? Are you sure?
Was that not?
We're like, but it was funny.
Yeah.
But so now it's a running joke that we mess with her.
And so
we're,
whenever something's really funny, we'll just stop and say,
we're like,
"That's hilarious."
but it's really funny. So y'all, we're fun.
That's
Okay.
who it is. Because
Yeah, y'all need to guess. We're not going to tell you, so you have to guess.
Okay.
And if you work here and you're watching, you can't
You're
cheat.
not allowed to guess.
You're not allowed to vote. Okay. All right. So what is
Especially if you're
happening?
the person.
Yeah, exactly right.
Okay.
So something is going to be happening this month.
What's
Actually,
happening?
that's another inside joke. We'll have to tell you
Okay.
about later. Okay. So something really amazing is going to be happening at our practice in literally like 2 weeks.
I wish that we could, when you had a twerk, so that we could be like, so we are having an event.
Yes, and you have got to be there. If you have been dying to have cool sculpting,
Consider this your official invitation from Ash and Jess
yes.
to come to our consultation day.
Mm-hmm.
And it's all about the peach.
And things around it. You know, everything flows. Everything
Yes.
is cohesive, right?
Yes,
So-
but right now you can use the savings for whatever you're wanting, whatever area, but
Mhm.
we are capitalizing on the boutique.
Yes, because it's big.
Yes.
I mean, everybody wants it.
So,
Poppin', right?
for our consultation day
Yes.
on August 29th,
29th. It's a Thursday.
not next Thursday, but Thursday after.
Yes.
So we'll have limited spots, but Jess and I will be there. Jess and I will be hyping you up.
Mm-hmm.
We can be in your console if you want us or whatever, but Ruby is going to be giving
Yes.
everyone customized treatments for both Selfina and Cool Sculpting.
Yes.
And a new fad that's in is little indentations or, things that aren't cellulite but you want them filled. Filler can go there.
Mm-hmm.
We can give you options about that.
Yes.
But we're really, really focusing on Cool Sculpting and Selfina.
Exactly.
And getting your bum, your peach to
in the perfect shape.
look as fabulous as ever. Yeah.
Yes, awesome. And the really cool thing is that, summer really has come to a screeching halt. I hate to admit that because I feel like I didn't get a summer.
Shout out to
busy,
Jess.
dude.
Her kids started school
Yesterday. What?
Did you
So-
have a celebratory cocktail?
I will actually this evening.
Oh.
Or this will be my impromptu one. So.
Oh my
cheers-
God.
Cheers to back to school, moms.
Funniest thing ever this morning, Jessica was telling me about how her big girl Ellie, she went on her own. She got
Didn't
out
turn
of mom's
around.
car, didn't turn around. Listen, and she's just sad. So she doesn't even turn around, and Jessica stopped the lady that was taking them out of the cars and was like, "Wait,
She didn't know where to
how?
go.
She's not gonna know where to. No." And she was so worried. And Landon was like, "Yeah, she's not gonna."
I
You're
know,
not
like,
helping.
Yeah.
But I remember my mom telling me stories about how she was so just her heart was like
My baby's grow.
exactly.
Yeah. So that was this morning. I was freaking out that my little kindergartner
Hey,
is
what's
not gonna find
what's
their
the
way.
thing that you have to do with your kids?
What?
Hug them.
Oh, hug them, love them, leave them. That's what they told us. We have to
And
do to our
that's what
babies.
we're doing with Cool Sculpting and your fat cells.
Yes, we're hugging them with the, and we're loving them in there, and then we're gonna leave them.
That was so good. And I just thought of that.
I know that was
Yeah.
actually.
So
It can be applied to anything.
we
in
hug
life.
them, we love them, aka freeze them. So how about hug them, freeze them, leave
Leave
them.
'em. Yeah.
But anyway, it's so cute seeing Jess being like
I have a junior higher, a kindergartner,
which is
and then a pre-K for. Oh, wow.
she has
That's
enough kids for both.
Yeah, I got a circus.
For
Alright,
now.
so, you guys, if you have any questions, make sure you do. Please drop them down here. You click that little share button right over there. You leave us a comment. Tell us your best dad joke, how much you love us.
I'll have Dr. Sukar look over and pick a winner either
Yes.
Monday or Tuesday, depending
Yes.
on surgery
So
schedule.
keep dropping your jokes and comments until over through the weekend, and then make sure that if Cool Sculpting is something that you've been considering and wanting to do or have more questions about, of course you can drop comments below. But you can always call and ask for myself or Ashley, and she'll get you over to me. That way I can answer any questions you have. But we are having, and we're hosting a consult day for CoolSculpting and Selfina. You guys have seen our Selfina video. If not,
So it's
scroll
a
down.
1 day only consultation day.
Yes, but what comes along with that is amazing things. So we've got
Great
huge
sales. Big
huge,
sales.
yes, huge
And
savings.
especially when you pair the treatments.
Yes, and yeah, even better. And you might get some swag if you are starting treatment. So you might want to start treatments now.
Yeah.
Okay. Yes.
All right, Jess. Is that all we've got for today?
I think that's a lot.
Yeah, this is a lot.
Should
I
we
know.
end on one joke?
Do you have it?
I don't know.
I should tell that one.
Oh,
that was
yeah,
supposed
okay,
to
good,
be.
okay.
But which one was it? Okay,
Oh,
yes. Yeah,
yes,
no, it was that one. Okay,
all right. So this we're gonna end on this joke.
Okay.
Okay.
I'm not sure if y'all know this, but mountains are actually very funny.
Are they though?
Yeah,
I don't know.
they're basically just hill areas.
Hill areas. Hill areas. Y'all, if you're not laughing, are you even living life right now?
It's probably because they don't have the daiquiris from
And
World
if you live
Famous Daiquiris.
if you live or drive near Clear Lake City Boulevard,
check them out. It's really
Yes.
cool.
Yes.
They have so many different flavors. If you've ever been to New Orleans, it's kind of like, when they have those daiquiri bars where they have like 10 different machines and they can mix different things and stuff. So
yeah, and you can buy them by the gallon, I think, right? Like you can buy like
liters, something like that. Yeah, you can buy
a lot. But anyway, so these are amazing. This is called, what's the place again?
World Famous Daiquiris and Margaritas.
Yes. So if you're near Clear Lake City Boulevard and El Camino area, drop by, tell them the PS show with Ash and Jess sent you. They might just give you a little high five.
Yeah, because we haven't gotten sponsored by them or anything. So.
Yeah, so it's just amazing. All right, so we have anything else for them? We're good?
I think we're good.
Okay,
I think we thought that this one was going to be like 15 minutes.
But when it comes to jokes, it's never short.
I know,
yeah.
right? So give us some more jokes to read.
Yes, absolutely. And make sure you click the share button so you can be in the cycle.
I'm no longer going to promise what we're doing next week because stuff changes.
But can I tell you something really cool that's going to happen next week?
Yeah,
okay, so next week we have a film camera crew coming out from California to be filming. So we're so excited. So
not to be filming at.
Well, yeah,
maybe.
But also the Souk, Dr. Sugar.
Yeah.
I mean, he's the star, right? So, but they'll be out next week. So we may plus or minus do the show on a different day next week, or we may, I don't know. So stay tuned. Make sure that you are following us on Facebook so you can keep up with all the news from the PS show, what's happening around here.
What are you doing over there?
I don't know. I'm just, like. Okay. All right. So
let's get out of here.
Yeah. So this is the PS show with
Ash
and Jess, and remember, beauty's in the details. You guys have a wonderful weekend. We'll see y'all next week.